Hello, my name is Thomas. Welcome to my YouTube channel. Today I'm going to be talking about my life leading up to the near-death experience and all the health issues that I've dealt with. So until I was 18, I was perfectly healthy. I did baseball, I was a pitcher, I played football, I was a tight end, and I did Kung Fu Sansu. And I was a good student. I graduated early so that I could work on getting my training in the emergency room. I wanted to work as an emergency technician while I got training as a trauma surgeon. I thought that exposure would be good for me while I went to school. But when I was 18, I was diagnosed with a stem cell disorder. It's called paroxysmal nocturnal hemoglobinuria. It's a pretty rare stem cell disease, but I was working in the hospital when I noticed a sudden 30-pound weight loss, which was pretty significant to me. And so I went to my doctor and they did blood tests and found out that my white blood count was really low, specifically my neutrophil count, which is what is your first line defense against colds or flus, is what keeps you from getting sick from everyday germs. And without neutrophils, you can get sick and die from a cold. And I was fortunate that they had developed a medicine called Neupogen. It was a shot that I gave myself every day to keep my neutrophil count up, but it caused horrible bone pain, so I suffered quite a bit. So when I was diagnosed with the PNH, I went to OHSU, Oregon Health Sciences University, and received what's called the antithymocyte globulin, or ANTGAM treatment. But I had an allergic reaction and developed what's called serum sickness. And I was in so much pain when I went into the hospital with the serum sickness that they put me in a coma. And the EEG, the electroencephalogram, showed that I was still screaming in my pain, or in my coma from the pain. And that was when I had my first out-of-body experience. So I went on living with this PNH. I had to stay on the Neupogen, give myself a shot every day. But I had this horrible pounding bone pain in my lower spine, in my ribs, my sternum. It just pounded anytime I moved. Even if I rolled over in bed, I would be in excruciating pain. And without the neutrophils, I developed meningitis several times. I had to have lumbar punctures a lot. I was seen at UCLA by a hematologist, and he really couldn't make heads or tails of it. They thought that I would eventually develop cancer, and that's exactly what happened. But during this time leading up to the cancer, I had great existential questions. I mean, I had dealt with such suffering. I wondered, what's the point of it all? And why am I alive? And why am I going through this? And I would plead for God just to take my life. And because I was in so much pain, I didn't even want pain relief. I just wanted to die. It was tough on relationships because I didn't sleep. Because I was constantly in pain and not wanting to do things. It was really hard on my girlfriends. It was hard on me, and that kind of rubbed off on my girlfriends. After my cancer, there was this period of 5 years where I was single and didn't date because I'd had such bad experiences in the past. So yeah, it was tough on relationships. After my cancer, I spent 5 years by myself, not dating, just kind of in an introspective period, but also because I was going through cancer and a stem cell transplant, and I had to be in isolation. So in my mid-20s, I developed acute myelogenous leukemia. I had been having my blood drawn every day at the cancer center because of my stem cell disease, and one day the cancer wasn't there, and the next day it was so bad, my white count was so high that it was an emergency, and my doctor called me and said that they were getting a helicopter to come from Stanford to get me. That ended up not happening, but I ended up staying in the emergency room and then being admitted to oncology and staying in oncology for 15 months while they looked for a stem cell donor for me. And during that 15 months on chemo and stuck in the oncology ward, I eventually developed what's called a neutropenic typhlitis, and that kills about 50% of everyone who develops it. And what it is it's an infection in your small intestine. And what happened with me was that infection got so bad, it got to the point where I developed septicemia. It spread into my blood, and it was overwhelming my immune system, and I ended up in a coma. I think it was an induced coma so that my body would have energy to fight the infection. And I was on really powerful antibiotics, most powerful available. And I had a pretty significant out-of-body experience. And again, I remember being aware of conversations that were going on around me. I remember hovering over my body and even traveling outside the hospital with my mind, I guess. So at that point, my doctors decided, well, we just need to do the best we can with a donor, and this kid is going to die if we don't do the stem cell transplant. So miraculously, I recovered from the neutropenic typhlitis, and after 15 months of looking, they found a suitable donor. It wasn't a great match, but it was suitable. And so I went down to Stanford to stay there for even more intense chemo and full body radiation. And the transplant went well. It was really anticlimactic. It's just kind of like hanging a bag of blood. And at that point, I'd been getting lots and lots of vials of blood. I had even, at one point, they had told me, you might die because we just don't have enough blood to give you. I guess I have kind of a rare blood type. But so the full body radiation just caused the worst nausea that I've ever dealt with, and that's really saying something. Afterward, the nausea just didn't really go away after the cancer. I dealt with it for years. It took working with Himalayan singing bowls actually to kind of cure the constant nausea and vomiting. So I had the full body radiation and the chemo. It was kind of nice. They even printed up a certificate, like a degree. It looked like a degree from Stanford, from the radiology department, saying that I had graduated from full body radiation with full honors and high courageousness. But I told them that they should be giving out degrees because the full body radiation really it's so challenging, and it is a course. So anyway, yeah, during that period I had to pull around a rolling suitcase that had a big bag of IV fluids because my body needed to flush out all those cells that the chemo and radiation was killing. So I had to live for 4, I don't know if it was 4 months or 6 months within 15 minutes of the hospital. So I ended up staying in I think it was $375 or $400 a night, and that was discounted from $500 a night hotel room. And Stanford didn't really have housing for all of its patients, so we ended up paying for a hotel and driving every day to the cancer center while my counts recovered. And I had to wear what I called my Darth Vader mask. It was a great big pink HEPA filter mask, dual HEPA filter mask, and because at that point, even a cold, anything could kill me. I had to eat a special diet that was like pasteurized or canned foods. I couldn't eat anything fresh, or, they didn't have me eating really healthy foods, more sterile foods. So I was doing great. I dealt with chemo brain, but that was just kind of like being in a fog. And I remember being really happy during that period for whatever reason, I guess because it was like being kind of stoned, I guess. I don't know. But the chemo brain was no joke. It was a pretty tough period to get through. And then I was weaned off the pain meds. I was doing really good. And I just all of a sudden rejected my stem cell transplant. And how it presented itself in me was in my stomach lining. I shedded the lining of my stomach and intestines, and it was an incredibly painful process. I was lobster red. I had to drive the 6.5 or 8 hours down to the Stanford University Hospital, the cancer center there, to be treated for acute graft versus host disease, which is the acute rejection of the stem cell transplant. And again, that was incredibly painful. I still deal with chronic graft versus host disease. I'll be on anti-rejection meds for life. And the high-dose steroids that they used to treat the graft versus host disease destroyed my joints. So I ended up having to have both my hips replaced, which was kind of dangerous because in the past, being on high-dose steroids, I developed DVTs in both my legs from deep vein thrombosis from my ankles to my knees. And so it was a huge risk of not only infection during the hip replacement, but I think I had something like 15 times higher risk of infection than the average 50 or 60-year-old that goes in to get their hips replaced. Just because I was on anti-rejection medicines and had a suppressed immune system. But so I developed what was called avascular necrosis. The steroids caused blood clots in my bones that caused the bone to die and crumble and break, and the sharp, jagged edges of the bone tears up the joint. So I had a high risk of DVT during the hip replacement, so they had to put in a special IVC filter, a intraventricular something filter anyway. And then that had to stay in longer than normal because I had to have both my hips replaced. But the hip replacements were painful, but they went smoothly. I still deal with a little bit of pain from my hips, but really it's all my other joints, my shoulders, my knees, my elbows, my ankles, all need surgery, or if the joint can be replaced, they need to be replaced. But so I deal with a great deal of pain, and it's been a great deal of pain throughout this whole process, but really, it wasn't until I had an adrenal crisis and ended up in the emergency room where I was working to kind of show me that I had come here to have cancer, and that my cancer, the silver lining of my cancer, was really enlightenment. It was kind of the price to enlightenment. So now I've learned to detach myself from the pain as kind of a dialectical thing, that I can be in pain and still be okay. So to need every joint replaced is a great deal of pain, and it has repercussions. Like, it's difficult to maintain my weight because I'm in so much pain all the time. I don't have an appetite, or I'm nauseous. And then pain is fatiguing. It saps your energy, it saps your motivation, it causes depression, and depression leads to anxiety. So there's all these
fallouts or repercussions of surviving the cancer, but it's what I had to do to learn the human condition and to learn how to overcome all these obstacles so that I can help other people. And I was trying to help people working in the emergency room, working in Western medicine, but Western medicine has both saved me, but it's also really failed me. It took becoming my own doctor to sort of sort all these complicated issues out. And I really believe people can be their own best doctors, and that the mind is a powerful ally to humanity. So I would like to thank you for listening to my third YouTube video. If you haven't already, I ask that you subscribe and like my video. Leave a comment. If you're dealing with anything that you would like help with, please leave a question. Let me know what's going on and I'll do my best to help. Thank you so much. Namaste.